essential mission of the Hhcga, and perhaps examine why this organization is needed. What difference does it make? There are many varied and other opportunities out there, government, private entities, that all are saying we're out to improve health outcomes. What makes the Hhcga different? Let's perhaps take the subject of COVID-19. Bella, the past 2 years of the pandemic, COVID-19, has brought about several major developments for communities in general and in respect to healthcare particularly. Would you share your perspective on the impact of such things as lockdowns and restrictions on where you can go and when and so on? What has that done to healthcare outcomes?
Absolutely, Asi. And Santiago and I have both witnessed this. From my perspective, having the basic of why it's important to our mission is because we were always very cognizant that policy, advocacy, better health outcomes needed to occur. And it needs to be linguistically correct. It needs to be relatable. You need to have a population of people who are serving those, who have a voice from the population. And from the perspective of COVID-19, that wasn't the only pandemic. The pandemic was access to health care. The pandemic was cancer screenings, HPV, mask mandates, mental health crises, alcohol crises. We have a generation of children, most that will never know how to have their learning in an environment that didn't involve a mask at the very onset of when it was important to see faces so that they could develop a language. So the pandemic is not just the pandemic of COVID-19, it is the pandemic of all the other comorbidities and chronic diseases that, one, contributed to it and made worse outcomes for minorities, and two, to that point, what is the next pandemic? A breast cancer screening that could have been a 1 3 years ago and someone was not able to have a test could now be a 3. So it's really looking at it in its totality of impact and not just in a silo-mannered perspective of COVID-19.
Right, and I think I can ask Santiago this question with some justification. As a younger man than myself, who of course would be told that I'm at a greater risk, what do you see as the lasting impact of the COVID-19 measures? And what do you see as positive from the overall experience that we've had these last 2 years?
Okay, well, I think if you want to think of the positive side is just think of how the whole entire world came together to find, because we were unprepared for this. 100% unprepared, not just on the public health side, but we're thinking economics, and it's just so many things that weren't ready for that. If you think how the whole entire world came together to find, one, the testing. How do we figure out if you have the virus? Okay, we got it. We found the testing, PCR, then we came to the rapid, we did that. Then we have the virus, where's the vaccine? Okay, we got the resources. How? That's still, to me, it's unbelievable how quickly we found the cure or the vaccine for this, correct? We found it. Now make sure that everyone has access to it. And that's where the Hispanic Health Coalition of Georgia and all these organizations come into place to be like, I have the vaccine for you. Let me take you to give it to you for free. This is, if you think about it, the cost of each vaccine it's very pricey. I don't have the number, but I'm thinking it's like $1,000, $2,000 for just one shot. We made it accessible to every single person in the world, not just Americans, of course. So I think that the positive side of it is that we can come together and find a solution for a problem. In this case, it was COVID-19. But just imagine if we all came together to find a cure to cancer. Wouldn't it be easier, faster, for sure? Not just that, HIV. if we're talking about that. Just all those chronic diseases that we have out there. I think this is a learned lesson from all of us, that we can come together and actually find a cure for so many more things that we thought, oh my gosh, that's not going to happen. But it can happen if we all work together on it. On the negative side of it, as Bella was saying earlier, yes, COVID-19 was a big hit, but what about the other chronic diseases? What about, as you were saying, cancer testing? What about HIV testing? What about just diabetes? Just regular, do people have access to healthcare easily? And what's going to happen afterwards? Is it something that we want to improve? Is it something that, like, what are we going to make? What are the changes that we want to make moving forward within our health and within our health system and the public health department around the world, certainly?
And I think to that point, Santiago, which is hugely poignant, it's a byproduct. So it shed the light of all the things that were not happening in unison. So as negative, that's not a negative, that's a positive. That's to say the underserved populations, the minority populations, people who do not have access to health care, individuals who do not have access to transportation. All of those elements at the onset might have seemed frustrating and negative, but it actually turned into a huge positive, because as other pandemics arise, we now know how to mobilize in unity, and we're very aware that we need to be reactive, but we need to be proactive.
And as I said at the outset of this segment, there is no doubt that the Hhcga is an entity that works with other organizations. We have chosen that as one of the key elements, key strategic elements, is to bring about and act as a catalyst for partnerships. So Bella, tell us why you think this approach to form partnerships is significant. I'm thinking now of CORE, I'm thinking of grassroots labs, I'm thinking of SEAL and other organizations, all the ones that we have tried to bring to the party. What has that done?
That's an excellent question, Ossie. From the perspective of a mission needs to be tight, concise, and on point. All-stop shopping is usually not effective in an organization. You usually have tenets of mission that you are subject matter experts to. So where our other stakeholders come in is with CORE. We do not have clinicians. That is not what we do at the Hhcga, but we support clinicians throughout the state in chronic diseases. So it was not unusual for us to partner with a team like CORE. When it comes to grassroots labs, which was domiciled out of our own Georgia Tech, right here in the state of Georgia, through the incubator, that team of why Hhcga partnered with grassroots is because they come from technology, they come from healthcare, but they have a passion to have better health outcomes for individuals. So with that relationship, we were able to bring tests for all chronic diseases, or a good set of labs, at 30 to 50% discount to the population. So any population, the population throughout the country, as a member of that. So even if you're insured, 40 to 50% less on a lab test should be open to everyone. So it's really looking at technology partners, public health partners, partners who have strength in advocacy, policy. So it's bringing it together so you can connect the dots. And as I famously say, I don't find it very effective to operate in silos. If everyone has either the same mission and it becomes conflictive, it becomes difficult to carry out your mission effectively.
Right. And Santiago, I read some exciting stuff about the events that you have largely orchestrated, for want of a better word, or organized. More than 35,000, I'm told, in the last couple of years is the kind of reach that you've had. Paint for us a picture of what happens at some of these events. I'm told about the one at Pendergrass that's kind of exciting. Give us a word picture of what happens there.
You started with a fun one. I could sit here and talk for hours about that one. That location is just perfect for us because it reaches the community that we're looking for, the community that we're passionate about, or Latino community, of course. And I think the amount of people that you see there, the hesitancy of the people that you see there, the community, which is one of the biggest issues that we have over there, is what motivates you to create new strategies. What can I bring to the table that's going to make it better? What can I bring to the table that's going to make you come to me and ask me questions? So when we started with CORE over there, and then with the Hispanic Health Coalition, what we've created is a health fair for the community. For this flea market, most of the community comes within 4 or 5 people. So a family, it's a fun trip. And you can find anything at this place. They sell from cars to washers and dryers to pigs, and you can find everything there. So when families come to this market, they're not there to get the COVID vaccine, for instance, or to learn about diabetes, or so you got to make it fun for them, and that's when the process starts. Like, what are some ideas that we have? And honestly, I think that we are doing a pretty good job at what we do over there. We have the COVID-19 available for the COVID-19 vaccine available for everyone, which, by the way, we just launched the booster for kids that was just approved by the CDC a couple of days ago. And if you move on, we have the Hhcga provides us with incentives for the people that get the vaccine. So if they get the vaccine, they get a gift card, a $50 gift card. But that's not it. It doesn't end there. What else do we do? So we bring a nutritionist, and she makes the food in place. We never want to teach them not to eat what they're used to eating in for their lives. So what do? We make it healthier. Same things, but just healthier, correct? And that's a hit right there, because they seem to be really interactive with that. And it's a way of catching their attention. And then in that way, we can come in and be like, okay, so are you also aware of all the services that we offer? So like all the chronic diseases that we offer. And I wish we had a pamphlet here so we could talk about it a little bit more. But it's just a way of, them coming to us to talk to them, teach them, answer questions that they might have. And sometimes they're just afraid to ask those questions, or they just don't know how to ask the right questions. So I think when you see a familiar face, they're like, okay, I have this question, and let me just go ahead and ask it. We also make sure we have face painting for the kids. We're trying to, we have piñatas, which are a big hit over there also. And what else, Bella? What am I missing? We just have so many things.
Hula hooping.
But
it's taking get up and move. It's taking diabetes, indicative of many races and cultures. You're not going to correct what we eat, okay? We are not all of a sudden going to adopt a healthy eating from another country that we know nothing about, okay? So it's not penalizing people. It's all in the education, but making it interactive, because our families are so interactive and multi-generational. It's diabetes, heart disease. Nobody wants to be preached about that. They want to be taught differently. And I think what else is highly impactful is, I would say that guesstimate 95% of the attendees, and it's 35,000 individuals a weekend.
Right.
That's a lot of people.
That's a lot of people.
And it's to the point that we speak their language. They're not intimidated by us. We don't seem like an agency that they would not want to interact with. We don't ask personal questions. And they relate to us because we're trusted in the community because we're from the community.